Hello, I'm Dr. Joshua Berkowitz. I'm the Medical Director of the Wimpole Aesthetic Centre in the West End of London. I'm going to speak about a range of common cosmetic concerns. Hello, today we're going to talk about vitiligo and how to treat vitiligo. Vitiligo is a common disease. It's of autoimmune origin and it affects all sexes and all races in much the same way, by creating patches of skin which completely depigment. It's obviously more visible in patients who have some degree of color in their skin. So in Caucasians, it tends to be less noticeable than it is, say, in Asian patients. If you look on the internet, there will be absolutely millions of sites which will claim cures for vitiligo. But in reality, there are only one or two cures or treatments which can control the disease. The two treatments which are worthwhile are melanocyte transfer, which is a skilled procedure to be done by experienced practitioners and invariably skilled dermatologists. It's beyond the realm of most general practitioners. And the application of narrowband UVB light, which again can be very helpful in repigmenting the depigmented area. Again, this kind of treatment requires repetitive sessions, and it's a very slow progress for most patients to repigment. It's a damaging disease in the sense that it has no medical consequence beyond the depigmentation in terms of the general health of the patient. But there are large emotional consequences in view of the fact that the disease is often in places where it's very visible, such as the face, the hands, the legs, and of course the torso. But particularly on the face, it tends to have very deep emotional consequences. It cannot be cured in all cases. Only selected patients can be cured. It needs to be stable. It needs to be stable for a fairly long time before any treatment can be undertaken. But there are centers which are able to provide the melanocyte transfer technique, and these one or two centers in Britain will make a vast and long-term or permanent improvement once the treatment has been performed.